So what I wanted to talk about today is this concept of preservation rhinoplasty and how it differs from the traditional rhinoplasty approach. First of all, there are only a handful of surgeons in the United States currently using preservation rhinoplasty, and most of those surgeons, aside from myself, are on the West Coast. But it's a really interesting and sort of amazing advancement in rhinoplasty, and I use it in my practice as often as I can. It's not for every patient that comes in, but probably 80% of patients are candidates for this, and I wanted to discuss exactly what it is today. So if you look at my screen here, this basically is a representation of a nose with a little bit of a hump on it, and as I play this video, I'm going to show you sort of how a traditional rhinoplasty is done. Basically what we do is if you can sort of imagine the skin and soft tissue not being there covering the nose, and there's cartilage and bone which is exposed, we basically shave the hump down from the very top. If you look at the anatomy of the nose, there are two cartilages of the nose, and you're just seeing the left side here, but this is called the upper lateral cartilage. It's on the left. This is the nasal bone on the left, and this is the lower lateral cartilage on the left side. There's the exact same thing on the right side. The blue is the cartilaginous plate that divides the two nasal cavities, and that's called the septum. And so what we do when a patient has a big hump is we basically trim that off, and as you can see here, it leaves spaces on both sides of the septum. And so what happens is that area needs to be reconstructed. And usually we do this by breaking the nasal bones and moving them in so that they meet the septum again, and we have to resuture these cartilages to the septum. And oftentimes those are cartilage grafts which have to be added in, and that happens very often in traditional rhinoplasty, that we have to add in those cartilage grafts to reconstruct the dorsum, but that's not the case with preservation rhinoplasty. Now I want to show you what a video representation of preservation rhinoplasty and how it differs. This video basically shows an animation of the concept of preservation rhinoplasty, and this video belongs to a colleague of mine, actually the one who taught me the concept of preservation rhinoplasty. And just to give you a little bit of orientation, what you see here again are the paired nasal bones on each side, and in a second you're going to see more of the anatomy of the nose. Let's play this. Now here, this is the septum that separates both sides, and here again, just for orientation, we have the upper lateral cartilage in purple here on one side, the same thing on the other side, and these are the two cartilages, the lower lateral cartilages in green, that form the tip of the nose. Now what's different in preservation rhinoplasty is that all of the top of the nose here is completely preserved. So we actually don't shave or cut away bone and cartilage from the top. We take the bone and cartilage from underneath the nose. Now here, pause for a second. Here what you see is the right side of the nose has essentially been removed. So the right nasal bone is gone, the right upper lateral cartilage is gone, and so is the lower lateral cartilage, which was in green. And here you're just seeing the septum of the nose, which divides the nasal passages. And in order to get the bump removed from the nose with the preservation concept, what we do is we take tissue from below the dorsum. This would be the native dorsum. We take tissue from below so that ultimately we can move the dorsum down and set it back. And this here is going to show you how we remove the tissue. The tissue can be either taken down here, which is the case in this video, or a strip of tissue can be taken from up here right underneath the dorsum. And when we take that tissue, we're taking, this is cartilage, we're taking cartilage, and we take a little bit of bone as well. Then what we do is we make osteotomies. These are cuts in the bone, as this video is showing you. We make a cut completely across the top here. That's an area called the radix. And then we make cuts all along the side. And then this area here between the bone and cartilage becomes a flex, where the hump normally is, becomes a flexible joint. And as you can see, once we've freed the bone, we're able to push the bone back and straighten the dorsum from the side. So we remove that cartilage, and you can see how the dorsum just sets down. But the advantage here is we've done nothing to change the native or natural dorsum of the nose that the patient is born with. And the benefit of that is that, number one, the dorsum doesn't need to be reconstructed. So we don't have the same need for extensive grafting material. You saw grafts being put in with a traditional approach. So we don't have that same need for cartilage and grafts. And also, there's absolutely no way to have irregularities of the dorsum when we've done nothing to touch it or change it in any way. So this also cuts down on revisional procedures. And if there is a revision necessary, it's usually only a very minor touch-up as opposed to an extensive procedure requiring lots of grafting. This is actually a schematic representation of what I just described. This is an artist's drawing, and this is actually on a cadaver. So here what you're seeing again is the side of the nose with the upper lateral cartilage removed, the nasal bone removed, and here you're just seeing the septum in the middle. And as you can see, this strip underneath the dorsum, this is the dorsum, that strip is being removed here, okay? And that's what you see here in this cadaver. That strip of cartilage and a little strip of bone is being removed. And by removing that, we make space for the whole dorsum to be able to be pushed down after we've made cuts, freeing the bone so that it can actually be set back. And here you see in this cadaver, he has a little bit of a hump there before the cartilage is removed. And then after the cuts are made and that tissue is removed, we actually are able to press the dorsum down and straighten it and reduce the height of the dorsum. Again, leaving all of this intact, so nothing is cut away from that. And here's a little video, operative video. Now at this point, I've made all those cuts. I've removed cartilage from the septum underneath. I've made the cuts in the bone here, but what you're gonna see is me being able to take this bump in this patient's nose and just push it down with my fingers and make the dorsum nice and straight. Now, what this shows is, this is a patient, this is not my patient, it was just a picture from off the internet, but this patient had a secondary rhinoplasty, and this is actually the after result. But what I want to show you here is this is the dorsum of the nose of a patient who had a rhinoplasty, and this only happens through the traditional approach. And that's not to say that the traditional approach always causes this. I use the traditional approach. I've used it for years, and when it's done properly, this kind of thing happens very rarely. But the point is that it can happen, and it just cannot happen with preservation. And the reason this happens is when too much cartilage or bone is resected or cut off from the top, or those things are not put back together properly, and then you see the irregularities after healing after several months to a year, and all the swelling goes away. You can see these just terrible irregularities in the dorsum of the nose. And so by using preservation, we potentially avoid any of that happening. Okay, there are two other components to preservation rhinoplasty. In addition to obviously preserving the dorsum, which we just discussed, there are two things that we do uniquely with this concept that most other surgeons don't do. And one of those things is the way we dissect the nose. So what probably 99% of rhinoplasty surgeons do is, and you can see it here in this picture, is when they dissect the nose, basically, you know, there's cartilage and bone that they're dissecting the soft tissue off of, and there's a little layer on top of the cartilage and the bone, and it's one cell layer thick, and on the cartilage it's called perichondrium, on the bone it's called periosteum. And this dissection is performed above that layer, so above the perichondrium and periosteum. And what you see here is these are the lower cartilages of the nose like we've seen earlier in the video, but there's lots of bloody tissue still covering those cartilages because we're sort of over that layer of the perichondrium. The significance of that is that all of the blood vessels and lymphatics of the nose are above the perichondrium. So all of those things get damaged, and what happens is that when the lymphatics are damaged and blood vessels are damaged, this leads to a lot of edema and swelling in the nose. So post-operatively, there's usually a lot more swelling, and down the road in terms of the healing process, the swelling lasts for a longer period of time. But with a subperichondrial dissection technique where we dissect underneath the perichondrium, underneath the periosteum, it's a very meticulous and methodical dissection, but we're able to preserve all of the lymphatics, all of the blood vessels, and so swelling is minimized, and the swelling really resolves incredibly quickly, and patients are back to activity and have much less social downtime. So on the next slide I want to show you, so again this is just a video I found on the internet, this is not me, but you can see how this dissection leaves a lot of bloody tissue around and potentially damages a lot of blood vessels and lymphatics. Here, this is the subperichondrial dissection. So this is that cartilage in the lower part of the nose. You can see it's nice and clean and white, and there's essentially no blood here. And this is there's a very clean layer above it as well. So all of those lymphatics and all of the blood vessels are completely preserved, and there's very minimal swelling at the end of the case, and the swelling dissipates very quickly in the post-operative period. There's a third part of preservation rhinoplasty, which is the tip plasti, and this is also done differently from most other plastic surgeons performing rhinoplasty. And here what I'm showing basically is another patient that I found from another surgeon on the internet, and this gives you an idea of the type of tip plasti that's done very often. What you see here is if this is the tip of the nose, you see a little fullness above the tip, which shouldn't be there. The tip should extend out a little bit more. And then if you just sort of follow the silhouette of the nose, this is kind of a broad curve, and it should be a little bit more refined, and the tip should be projected a little bit more. In addition to that, this part right here, which is called the columella, really hangs down below this right here, which is called the alar rim, and that should be further up. And so again, the concepts of preservation, the tip plasti does not have to be done with preservation, but yet those of us who are teaching the concepts of preservation use similar or the same type of tip plasti, and this eliminates all of the sort of obvious signs of a rhinoplasty when traditional techniques are used for the tip. So we just discussed how the tip plasti is performed differently in preservation rhinoplasty, and I just showed you a profile of a tip that was done in sort of a more traditional way and the shortcomings of that. This is a tip from another surgeon that's done also in the traditional way, and this is the obviously frontal view. And while this isn't bad, and I mean the tip is maybe a little bit smaller, it sort of has the telltale signs of rhinoplasty in my opinion, because if you sort of look here at the light reflex, it kind of comes straight down here and around, whereas there should be some little shadows here making the tip complex not look like this round ball here, but sort of a little bit flatter and narrower. And it requires special techniques to achieve this, but more often than not, this is the sort of type with kind of tip with sort of the pinched look, and you have sort of shadows here which shouldn't be here because it looks kind of pinched and round and bulbous. So now I want to show you, so this is really what the tip should look like. In here you can see perfect paired light reflexes that occur on the nose with flash photography, and the tip just looks sort of a little bit more compressed. It's not this big round bulb, and there's shadows in here that make it look like the tip is actually separate from the dorsum. So it doesn't sort of, you can't see these sort of light reflexes that come around and just look sort of like a perfect U. It sort of comes down more like this, comes out, then around, and then in, and then back up. I just showed you the tip that's done with the preservation concepts, and that is a patient of mine, and this is also a patient of mine where I wanted to show you the tip from the profile. We were just looking at the frontal view. This is the profile view, and as you can see, you know, beforehand, again, she has that sort of low columella relative to the ala, which with traditional techniques is often not corrected, as I showed you in that prior picture of a patient that wasn't mine, where that columella is really hanging low still post-operatively. Here you can see that that relationship is fixed, so it's supposed to be a little bit lower, but only by a millimeter or two, which it is, and it's nice and parallel to that alar rim. And then this angle going around the tip is a much narrower angle. It's not a big, broad angle like it was in the other girl that I showed you. So just to recap, the three concepts that are different here with preservation rhinoplasty are: number one, we're preserving the dorsum completely. Number two, we're doing a dissection in a completely different plane, which minimizes swelling and minimizes downtime for the patients postoperatively. And lastly, we're doing a tip plasti, which is completely different and makes, in my opinion, the most natural, unoperated looking tip. And in a future video, I'm going to show you exactly how I do that and what we do differently with the tip. Thank you for watching.